Hi there, my name's Kathy Makin. Over the last 12 weeks I've undertaken studies in the area of creative therapies. Creative therapies is particularly important for me as I work with children and young people, and I'm looking at implementing creative therapies in my work practice. As part of the course, we were asked to provide a portfolio item which we could use in our workplace. I would like to present my picture today to you, and this will be covering the learnings in the areas of power, relationships and connection, boundaries, and also cognitive behavioural therapy for creative therapies. Thank you. So this is my picture, which as you can see has been created by using natural materials. I understand that this can be particularly useful when working with Indigenous families. My picture is a tree. I love trees. I love being with them and being out in nature. So this was an automatic thought when thinking of how to create a visual depiction of my learning areas. I started with the use of a native plant to create a border around my tree, and this was from a yucca plant. This border represents boundaries within the therapeutic relationship. As mentioned, I work with children and young people, and they've actually experienced childhood sexual abuse. So therefore, boundaries are a really important part of my work to explore, particularly in relation to body boundaries. When working with Indigenous clients, however, I appreciate boundaries can be different to non-Indigenous clients, particularly if counselling is taking place in remote communities, where the likelihood of seeing the counsellor outside the therapeutic space is more likely. Flexibility should be considered to accommodate where the client is psychologically, and having a blend of Western and Indigenous approaches to boundaries would be of benefit. Secondly, I'd like to discuss the sun, which is depicted here as a yellow flower. The sun can be extremely powerful. However, without sun, trees would not survive and are therefore an essential element of the process. This relates to power in relationships. Power differentials should be avoided in the counselling arena. In my work with survivors of sexual abuse, power in relationships is discussed very frequently in sessions, given that the use of power may have led to the childhood sexual abuse. This resource will be a visual representation which I will use to demonstrate how power can be equal as opposed to disparities, which will be imperative for my young clients to know going forward so that they have an understanding of what a healthy relationship looks like. My third topic is relationships and connection. The relationship is the most crucial element of any therapeutic engagement for a successful outcome. For healing to occur in children that have experienced trauma, it's imperative that a positive relationship is modelled within the counselling space. Relationships are demonstrated in my visual aid by the roots of my tree, which go deep down into the earth, enabling the tree to be strong and to flourish. This represents the relationship between the tree and the earth. Whilst working with children who have experienced sexual abuse, healthy relationships and connections are crucial to healing. A dialogue would be established to discuss the importance of this necessity, as a child is more likely to process trauma through healthy connections rather than in seclusion. Within a creative session, if I as the counsellor can offer a safe space for the young person, this may provide an opportunity for them to discover and to nurture themselves, whilst creating a bond with myself. When working with Indigenous clients, it's crucial to be aware of what I can improve on in my clinical practice. Connection is imperative to healing and may not be possible within the traditional westernised setting, so working in open spaces where connection to the land is accessible is more likely to be welcomed, and I'll certainly be more mindful of this in my practice. Finally, along with other westernised approaches to healing, CBT has its place as a standalone modality. However, if it's blended with creative therapies, it can lead to a more successful journey for the client. CBT attempts to uncover the client's unconscious processes and subsequent behaviours. However, this may not always be possible to access within the counselling space. Within a creative therapy process, opportunities can be presented through creativity to access the unconscious, providing insight and leading to behavioural changes. This can be done by providing materials to the client who may unearth undiscovered feelings, which can be brought through the creative process. Cultural considerations in the CBT approach are crucial, and adapting the delivery should be explored whilst maintaining the basic premise of the modality. Within my visual aid, I've used leaves to depict growth and change within the CBT process. Deciduous trees lose their leaves at a certain stage of the life cycle, normally winter. When spring arrives, the leaves begin to flourish once again. And my rationale for choosing this is that parts of the tree, or indeed the psyche, can deshed in a way, leaving room for new growth and change. Throughout the process of working on my picture, I've been able to reflect on my learnings, whilst creating a useful resource that I'll be able to utilise within my workspace. My plan is to display this in my counselling room, and will utilise my visual aid primarily when offering art therapy workshops for clients. I may also use this in individual sessions, if appropriate. The reason I've chosen this media is, as said previously, my current cohort are children, and I feel this will be an informative visual guide to help children through the different topics utilising bright colours and natural resources. Power, boundaries, relationships and CBT are all crucial to my work with children who've experienced childhood sexual abuse, as these topics are referred to throughout my sessions. In addition, some children may find it difficult to talk in the traditional therapeutic way. My desire is to incorporate art and creativity into my sessions that will seek alternative ways to communicate and enhance my current skill set. This unit has provided me with useful insight into the world of creative therapies and has allowed me to delve into my creative side. I was surprised how much I enjoyed creating the picture and how this was able to be a true representation of the work I currently do, as well as providing tools for me to implement into my future practice. This experience has also highlighted my desire to learn further in this area, and my plan is to complete more training in creative therapies to allow for additional discoveries of how I can implement this modality into my practice as a counsellor. Thanks for listening.